A 25-year-old female had reconstructive surgery 3 weeks ago after suffering a penetrating injury in the infratemporal fossa. Her recovery has been uneventful. However, she complains that food has not tasted the same since the accident. During physical exam, the patient is able to distinguish between hot and cold sensation on the anterior and posterior part of the tongue. However, there is an inability to taste on the anterior two-thirds of the tongue on the same side as the penetrating injury. Which of the following nerves was injured? Tongue innervation. We break down the tongue into an anterior portion and a posterior portion. For the anterior portion of the tongue, you want to be aware that my taste sensation is going to be carried by chorda tympani, a branch coming off the facial nerve. For the anterior two-thirds of the tongue, general sensation is going to be carried by my lingual nerve. Therefore, we have to be aware that in order for my chorda tympani to give that innervation for taste sensation for the anterior two-thirds of the tongue, it's going to hitch a ride along with my lingual nerve. Now discussing the posterior one-third of my tongue. We need to be aware the posterior one-third of my tongue is going to be innervated by cranial nerve number 9, the glossopharyngeal nerve. That's going to do both taste and general sensation for the posterior one-third of the tongue. Therefore, looking back at the question, the patient is not able to distinguish taste in the anterior two-thirds of the tongue on the same side where she had the penetrating injury. Therefore, the best answer in this case would be my chorda tympani, because we know the branch of the facial nerve, chorda tympani, will be innervating the anterior two-thirds of the tongue for taste. Don't forget to like and subscribe to the YouTube channel. If you have any questions, don't hesitate to contact Med Tutors on the email provided in the descriptions.